Welcome to the Well-ish podcast, sponsored by Iowa Specialty Hospital, where real life meets better health. We're your hosts. I'm Derek.
I'm Anthony. Let's dive in.
Super excited again. Welcome into the Well-ish podcast. Anthony and I are pumped today to have on another guest. We've been kind of crushing it with the guests lately, really working the Exploring-ish series.
Yeah, Exploring-ish. Yeah.
So today we have Dr. Todd Eibes. He's on with us today. Clinic leader of the Iowa Weight Loss Specialist. Medical director.
Put some respect on that.
Thank you.
Medical director.
And so, yeah, we really just are excited to get to know you today a little bit more about kind of what the things that you're excited about. And obviously we were talking a little bit before we got started about some of kind of the combo of what you do with surgery and then kind of maybe bring in some of the GLP-1 medications in. I'll be excited to dive a little bit more into that too.
Sure.
So
sounds good.
Yeah. Awesome. Well, I guess first off, why don't you kind of just tell us a little about yourself, kind of what this clinic has been like and where you've come from?
Sure. Well, I'm the medical director of bariatric surgery. I've been a bariatric surgeon for 25 years. Graduated from the University of Iowa, did my residency out in Detroit, and came back. And I had the opportunity when I was at the university to work with Dr. Edward Mason, who is considered the father of bariatric surgery in the United States, started the American Society of Metabolic and Bariatric Surgery. And I had that chance when I was a student. And then when I came back out in my original practice in Grinnell, Iowa, we were doing some bariatric surgery. And I started to just enjoy it more and more and more. And gradually, I started practicing in 2000, basically. By 2006, I was doing only bariatric surgery, took over my practice. I left Grinnell and went to Unity Point and became their director for like 11 years or so, and really kind of restarted the program and grew that, and then left there and came to Iowa Specialty. And I've been with Iowa Specialty now 11 years. Basically doing medical. And it's my overall philosophy that you have to have an overall comprehensive program. I mean, it's been one of my core beliefs that the surgery is just a tool to help regulate your hormones and control your appetite. But you also need a medical team. You need a psychiatric team. You need dietitians. You need experts in all of these other areas to help you, because it's not just a quick fix or one thing. Like if I adjust your appetite, but you're eating because you don't like your spouse and dealing with depression, we've got to deal with all of these different issues. So this hospital has really allowed me to explore that dream that I have of leading a big team. And so that's where we have a big team of specialists to help people.
Yeah.
Yeah, that's great. And I think I'm going to drill down a little bit more and go further back. Like, let's talk a little bit about like where you came from, what got you to, like, why'd you go to the University of Iowa?
Yeah.
All those
We're
fun
going
little
to the
things.
distant
We're going
past.
to go way, way back.
Distant
Let's
past.
start from the beginning.
Okay, so
Why
originally
Hawkeye?
I'm from Burlington, Iowa, and so my family was a big farm family in Iowa, so that's why I had always looked to the university. And my mother was a nurse, and I think from a very young age, I think a lot of people that go into surgery and medicine know from a young age they want to be a surgeon or that sort of thing. So I always kind of knew I wanted to go in the medical field. So I've been working that way, and I obviously did really well at school and classes. And then when I got to the university, everything was focused on getting into medical school. And so from there, once I got into medical school, everything in medical school, I realized I don't want to do anything but surgery. And so as I went through, I was pushing more and more, which again, I originally thought was going to be general surgery, and that was my career, and I'm board certified in general surgery. But as I got out in practice and started working, again, we go back to the younger stuff in a minute, but as I started working, I found that one of my core things that always bothered me, that if somebody had cancer and I operate on their cancer, I can have a great degree of skill. But if it's in the lymph nodes, if it's spread, I can't necessarily cure them or make a huge difference in their life. But with bariatric surgery, if I do a great job with a really low complication rate, most of them are going to do fantastic. So I really got into that field where I really just enjoyed doing bariatric surgery. Plus, I like to fight for the underdog. So many people have given up hope and they think there's no way out of this. And there's so much misconception that we can talk about medical and about surgical weight loss. I always joke with people, if you go to a dinner party, are you asking a cardiac surgeon about, whether you should do a stent or whether you should do open heart surgery? And if I go to a dinner party, everyone's got an opinion on what diet is the best, maybe keto, Weight Watchers, nutritionists, the tops, and everyone's an expert.
We feel that.
So we
Yes,
see that all the time. So,
understand.
but yeah, I love it. I love fighting for the underdog and do what I can. So, yeah. And
That's
then
awesome.
fitness has always just been part of my life. I enjoy working out. I enjoy lifting weights. I enjoy exercise, things like that. So it's just kind of worked out well together, complementary.
Very cool. Very cool. One thing you keep mentioning is how like surgeons just kind of know whether or not they want to be surgeons from a young age. What is that? Why do you say that?
I guess you have to look at things like, do you want to manage hypertension? And if somebody has hypertension, you're going to adjust a bunch of different medications and lifestyle factors and things, and you're going to really help them over their life, but they're going to have this chronic condition that you're working with, or rheumatoid arthritis, or many other things. As a surgeon, I can usually cure most things. Like I enjoy somebody's got appendicitis, I take out their appendix, they're completely cured, fix the whole problem. And so that's kinda how I got into surgery. I'm just more of that, I wanna do something, fix the problem, that's it, they don't need me anymore,
Interesting.
sort of
Mhm.
thing. And
Yeah.
so in the weight loss world, I'm just trying to give them a tool to help control their appetite, and then my team will guide them, but the team is gonna have a really hard time until I get their appetite under control.
Yeah.
I
Yeah.
can speak to that, right? I mean, so because I think that's the interesting piece that as a dietitian, when I'm working with a patient, we can work through all these different things of like, okay, here's some different tools that I have in my tool belt to help you not feel as hungry, not feel like this drive towards eating a bunch of food. And what's really helpful is if someone has taken that surgery route, that issue is usually a lot easier to navigate.
Yeah.
For sure.
I do think it definitely it makes it though it brings up all those other things that you kind of touched on where like is it the spouse, is it the work, is it the job that you're going through that's causing the stress that keeps you doing that. That's where that really becomes apparent, right? It's post surgery when we're working with patients, like navigating those things because you still have that habitual, I don't want to say need, but want to, you know, respond to those things in that way. So
For
do you
sure.
want to talk a little bit about that? Because you
Yeah. It's fascinating. As we get to that, I sometimes back it up a little bit because if you really think about how somebody's appetite is regulated, and things have really changed over the last 20 years. And I liken it, like when I'm talking to a patient, I liken it to high blood pressure. Okay. Your blood pressure is regulated by a lot of hormones in your body, and you have a pressure receptors in your carotid. You have enzymes being made in your lungs. They're affecting your kidney. And all of these things are regulating, even the walls of the blood vessels have relaxing factors and things, and it's a complex interplay working together to regulate your blood pressure. Okay. And if people have high blood pressure, we don't judge them as good people, bad people, anything like that. If you look at somebody's weight, it's being regulated by hormones in a very similar way. And I don't care how they got to their certain weight, whatever weight they got to, ghrelin is a hormone that's being made in their stomach and it's interacting with pancreatic polypeptide, cholecystokinin, GLP, GIP, amylin, incretins. There's a vast amount of hormones that are regulating their appetite. And so when they decide that they want to lose weight and get things under control, they hear these things like, you know what to do, move more, eat less, cut down your calories, all this sort of thing. The minute you do that, you're altering these levels, and these levels believe that you're starving to death and dying because they're regulated based on the diet for the last 2,000 years. But we have very calorie dense food, very high calorie food now, and your body's just not able to deal with that. So these hormones are overshooting. So most people, 99% of people that come in to see me have tried 7, 8, 10 different diets over a 5-year period. And they get in this cycle of failure and they feel horrible, like it's their fault. And you can try the tricks and try this, try that. But I need to get in there and do something, either with medication or with surgery, to alter their appetite. And once I do that, then they can do everything that our dietitians are telling them. You're working with them. You can give them a constant calorie diet. You can give them a diabetic diet. But once they get the appetite under control, then they can succeed and do that. And it doesn't make them a good person or a bad person if they didn't succeed. They internalize it and they hate themselves and they're frustrated that they couldn't lose weight. But that's just how your body's designed. And it's really interesting when you look at obesity's really only been a problem since 1990 going forward in the US. And you look at the food supply that we have, very high calorie, very concentrated carbohydrates, things like that. And I understand from a business standpoint, if you want to sell the best potato chip or soft drink or something, you're making it sweeter, you're making it taste great. But these things are a vast amount of calories, and our
Mhm.
bodies just aren't able to deal with that. So all I'm doing is giving people a fighting chance. And once I alter that, then our team can start addressing the secondary issues. Like you're talking about, if you're eating because you're depressed, I need to get your appetite under control first. And then once your weight starts coming down, then we can look at those issues. Because there's so many things. You work the night shift, you're eating to stay awake. You don't even know what calories you're supposed to be eating. You think fast food every day is okay. And we can start tackling those. But if you tackle those without using medications or surgery, it's almost always every study will show your chance of success is 1% or less because you can't overcome that drive to eat. Just like you can't will your blood pressure to be lower, we need to make adjustments with medications and
Mhm.
things.
Yeah. Do you find that like once people have the surgery, what's the kind of the difference between their ability to maintain? Because I feel like most people can try and lose 10 pounds, right? No matter
For
whether you
sure.
have surgery or not, lose 10 pounds, great. Obviously, we encounter the people who lose the 10 pounds and then gain 20, right? So, kind of what's the success rate beyond a year after having surgery?
Most of the studies, if you look long term, if you look 3, 4, 5, 8 years later, average, whatever their weight loss that they achieve with the surgery, 50% will maintain that weight loss. 50% of people will gain back. And they always tell me, "Oh, my surgery's not working. It's terrible." And then I say, "Well, yeah, but are you going out to the bar drinking with friends every night? Are you eating a lot more carbohydrates? You lost weight. Now you're partying and doing things." That's when the secondary factors start to come in. Now, it could be that I'm wrong, and it could be that their other hormones are upregulating or increasing their appetite. But I think that's why it's really exciting. I would say we're in a renaissance right now. We
Mhm.
have such good treatments. For example, if I do a sleeve gastrectomy and I remove 70% of your stomach to remove 70% of these appetite producing cells, and like you say, you do well, you lose 80 pounds, you're fantastic. 5 years from now, you start to gain a little bit of weight. We can add a GLP, we can add a GIP, we can add the medications will all work better after the surgery. And every study shows the surgery will get better weight loss if we use medications with it. So I think we're at a tipping point right now because it's always been a cost issue or different things. But as these costs come down, you could take that patient if 5 years later something happens and their appetite starts to increase, let's just add a medication. We tell people we're like a carpenter. We have a tool belt with a lot of tools, and we can try all these different tools. Maybe it's counseling. Maybe it's just working with a dietitian about making good food choices. Maybe it's a medication, but we have a lot of options. So, but the
Yeah.
first step, the by far the most proven for dramatic weight loss is either surgery or one of the new medications.
I'm a big numbers guy, so I just wanna make something clear about that because you said 3 to 5 years after, they still maintain about 50% of their lost weight.
Half of the patients will maintain. So let's say your BMI is 45 and you're 150 pounds overweight,
'Kay.
and we do surgery, you're going to average 60% of the excess weight gone. So we
Okay.
would tell that patient, on average, you're going to lose 90 pounds. So a year later, maybe they're down 80, 85, 90. 3 years later, half of those patients maintain all that weight loss.
Okay.
But
Yeah. So
then half of them will gain back some,
sure.
and that's where we really gotta figure out why are we gaining. That's where I think it's also crucial to work with a team that specializes in weight loss. I worry because as the meds are becoming more prevalent and you can get them, you can go to these hormone replacement clinics, you can go to chiropractors, you can go to family docs, you can have all these people giving you the medications. It's great, and I would say we're all on the same team, we're all trying to do the best.
Yeah.
but you're not getting the dietitian counseling. You're not getting the psychiatric counseling. You're not
Definitely.
getting so I think you'll get better long-term results by seeing a specialized team that's all we do here.
Yeah. No, I think that's a very good point because no one is in healthcare to make someone more sick or not attain their goal, right? But here at our clinic, we have a comprehensive team, to your point, that, can one, like there's multiple people on the team that have different perspectives or can, maybe relate to that person better. But two, if it's the diet, we can work with that dietitian. If it's mental health, we have those therapists. And then if we're needing to mix up the medication, thankfully,
Yep.
we also have the nurse practitioners or the providers that can change that as well.
Yeah,
Yeah.
absolutely. You'd be surprised how many women find out they were in abusive relationships and they didn't even know it until they lose their weight, and now they feel empowered and they start looking at their life and say,
Mm,
"This is a mess." And so then they'll come and
Wow.
see our counselors.
Have you kind of always had the same makeup of the team as you were trying to kind of put it together? Has that evolved and shifted?
It's always been my vision of having that team, but I think some places look at, well, how do you make the money?
Mm,
And from a business standpoint, I mean, hospital systems will look at most of the money's made with surgery. But really all I care about is, helping a big group of people and doing the right thing for the patient and whatever. So this hospital was one of the first ones that kind of gave me a carte blanche to really kind of go at this thing. And I remember the very first day I met with administration, I drew up on a whiteboard what this whole program was going to look like. Because you have to have, in my opinion, you have to have the psychiatric care, you have to have the nurse practitioners, you have to have the dietitians and all of that. But there are many programs out there that are missing a lot of that, or a lot of them for traditional bariatric programs who just do surgery and don't have the other stuff. I know there's some programs that say you're graduated at a year. I don't buy that. I think you still need help down the road. You have a death in the family 2 years later and you're dealing with it by eating. We need to be there for you and help you. So it's hard to get systems to understand depending on the reimbursement. And that's where I think we're in a kind of a unique thing where our hospital really embraced that would allow me to gather a team of specialists to do all of this sort of thing.
that's cool. I
yeah,
think
that's
that's really
great.
cool.
I also think I mean, when you're talking about that, I also think it's hard to get the patient to understand and commit past that year as well. And I don't know if that's maybe because of what they've heard outside of our clinic, but I talk about it, and I know others have like stay longer. It's not just at that year marker where you don't need to come out like every couple months. We still want to see you back, especially for those moments. To your point,
Totally agree.
because once you join our program, I mean, our goal here is to, I mean, we talk about this all the time. Walk by your side, help you get to where you want to be.
Yeah, and it's hard because we've tried a lot of things in the program like support groups, like group therapy and things like that. And a lot of patients they'll do okay with their surgery. I think they could optimize things by taking more advantage of these things. I think group therapy and support groups and all this stuff is crucial. But a patient may have surgery, lose 80 pounds, cure their diabetes, and like, well, I'm not going to come in once a month for a meeting, things like that. So we got to meet them where they're at, but we have opportunities. I think one of my biggest frustrations I hear is patients 2 years later, they start gaining weight back. They're afraid to come in because they're going to disappoint me.
Yeah.
If that's the case, come in. We have specialists. We can help you. You're not, I think it's because they've got in this cycle feeling like everything is their fault.
Mm.
It's not their fault. We need to work on this. Now, I have a hard time believing that something's happened to the surgery and it's gone wrong. But maybe we need a med, maybe we need counseling, maybe we need other people to help them out.
Yeah. I mean, it's almost, I often think about, I talk about physical therapy a lot, but if you injure a muscle and then you go to physical therapy and get it, taken care of, and then you injure it again, you aren't going to not go back to physical therapy to take care of
Right.
it. And it's the same thing with your weight. I also usually relate that to like mental health as
Mhm.
well. Right. But people, yeah, I don't know what that is. Maybe they just feel down about themselves, which is understandable, but yet how can we, make them more comfortable to be
Mhm.
willing to come back and take
Yeah,
that
for
step?
sure. For
Yeah.
sure. I think the first step, what I always tell people, my real job is to give people hope. Because there is a way out of this. Your body is designed how it is, your hormones are how they are. So, especially when I teach seminars and group classes and things like that, this kind of light comes on to people because they say, oh man, I've been dieting for years and I've been on 7 different diets. I never realized that, if I'm in a calorie deficit for a month and I lose 10 pounds, if I draw their blood, their ghrelin level's sky high. And for them to overcome that, it's very difficult. So we have effective treatments, and we can discuss costs and things like that. But between the surgeries and the medications we have, we can put a lot of these conditions, especially losing weight. There's 20 different conditions it's going to affect. I mean, heart disease, cancer rates, diabetes, sleep apnea, all these sort of things. So
Yeah.
we make huge improvements, but there is hope. There is a way out of this. And I always encourage people, it has to be evidence-based proven medicine, and we really need to talk about that. So,
Yeah. Why do you think that support groups would be so powerful for these individuals? And why do you think that, I mean, you touched on it a little bit about why they don't come back or join those groups as much. But I feel like there's more to it. So what are your thoughts on that?
yeah, I think people underestimate the amount of mental health issues that are wrapped up into their weight, and I don't think they understand how they've been discriminated against. I mean, they'll tell stories about they go into a store and people won't help them because they're 150 pounds overweight, things like that. There's this subtle undercurrent of abuse, and they're treated poorly because of their weight, and they internalize these things and think it's their fault. And I think they underestimate that. And I think they would get a lot of benefit by working with mental health counselors and other people that have been through the same situation. I mean, I can get their weight under control for the most part, and I can get their appetite down. But I think until you address these issues, I think it's a ticking time bomb. Are you going to have trouble 5 years later, 10 years later? Do you return to drinking? Do you return to doing, bad habits sort of thing?
Hmm.
So,
Yeah. Yeah. I'm going to ask you a challenging question because I've gotten
okay.
this question before. It's not really
I
challenging,
like
but
the hard
but
questions.
uh,
Mhm.
it's a personal question. Have you ever dealt with weight challenges?
Well, when my kids were young, I was 30 pounds heavier than I am now at my max, or 25 pounds heavier at my max. And I decided this is ridiculous. So I'm really an all or nothing. So I did Body for Life by Bill Phillips and the 6 meals a day and portion sizes. And I just really controlled what I was eating and worked my way down. Plus, I love exercising and doing stuff. So I'm probably not typical that when I commit to something, I'm gonna do it. I mean, that's kinda what
Mm,
drives you through medical school, and you get through some of these hard residency. I mean, my residency, I worked 100 hours a week for 5 years straight.
it's
So
crazy.
so I could drive through some of this stuff. So, yeah, I lost weight, and it takes a long time for the hormones and everything to reset. If you do it that way, it's probably gonna take a couple of years to reset, but then after that, I've been stable. But exercise is an important part of my life. I don't
Uh-huh.
feel normal if I don't exercise every day. I
Uh-huh.
exercise pretty much every day. I'm borderline overtraining from time to time, but I want to be on the treadmill. I want to be walking. I want to be moving. And there's some recent studies come out when you look at frailty index and muscle mass, they say you really should be training for life. You should be lifting weights. You should be increasing bone mass. You should be increasing your VO2 max and your bone max, how well you consume oxygen is really going to determine the last 10 years of your life. Are you in a wheelchair or are you healthy and living and doing things?
Yeah.
So I train just to live.
I love that.
That is
Amen.
awesome.
Yeah.
Let's
I mean,
go.
that's the way to do
And
it.
that's why you're on the couch right now. Come on, Dr. Ibis.
And
Yeah.
most of these patients will say, oh, they can't exercise, they hurt or whatever. But if I can get 50, 60 pounds off, you can exercise. And
Yeah.
maybe it's just
Mm.
walking, but we have people running 5Ks. We have people doing all kinds of things. So, and it's not tomorrow you're going to do it. But I think you need to replace the unhealthy habits in your life. Just like you have people bringing you down in your life, you need to surround yourself with a core group that's going to help you be better
Yeah.
and change your habits to exercise and making a commitment.
Absolutely. Have you heard of Ethan Suplee before?
I have not.
So he's the guy, I always blank on the name of this movie. You know what I'm talking about. He was in uh oh
Oh,
gosh, My Name
football.
is Earl. You ever heard of My
Mm.
Name or the football
Oh,
movie
he's
Remember the
Remember the
Titans?
Titans.
He was a
Yeah,
No,
yeah,
really
yeah.
big dude in Remember the Titans.
I haven't seen the movie,
Anyway,
but I've
he's
heard of it.
lost
I've
like a
heard of
couple
it.
Yeah.
100 pounds.
Nice, nice.
But one thing he talks about, which I thought was, I mean, he had this great, like 2.5 hour podcast to listen to. But a couple times I've listened to him and he mentions how he had to basically break up with his social group and friend
Mhm.
groups and find new friends that valued similar things to him so that way he could make a lot of those changes. And it wasn't just weight, like we're kind of talking about here, that was bringing him down. I mean, he was involved in, alcohol and I think some drugs here and there too, but he talks about all those things you mentioned about the struggles and how long it takes to lose weight. And one thing that I really try to talk to people about is expand that time goal. Like,
Mhm.
you might, I'm assuming you lost those 30 pounds probably
A
within a
year,
couple months to a year. Yep. But to your point, it still took another couple of years on top of
for
that
sure.
to really let those things settle in your body to adjust, even probably your mind. And that's not talked about enough, I think.
Absolutely. And that's where I really think in the past, we had required our support groups before surgery. And I think that became a barrier for people because I have people traveling 3 and 4 hours to come. But in those support groups, they formed walking groups, they formed friend groups. And so commonly we would have 4, 5, 6 people supporting each other and doing things. And they were surrounding themselves with people going through the same journey, going through the same
Yeah.
thing, and being positive influences in each other's life. So I would agree with that for sure.
That makes me think, and I'm sorry, I didn't mean to cut you off
Are
there,
you
Derek,
good?
but really quickly, I wonder if maybe we can form some sort of support group with each, because the way that we go about this here is every surgery day, there's 6 individuals that have surgery, right? How can we get them maybe to sign like a waiver so that we can give them, the names and the numbers of the people next to them?
For
But maybe
sure.
that's like a little
Kind of build a
small
cohort of
support
some
group.
kind.
Yeah,
Yeah.
because I actually heard one patient. I've had one patient who talked about how she talks with some of those people she met
Yep.
on
Mm.
that surgery day.
Yep.
Maybe that's a good way we could go about it. So something to
I'm
think
all
about.
for it. We've done things like that in the past or get some patient champions who are willing to share their experience and start with that. And if you get a group of people, they'll share their numbers and just kind of start from there.
Yeah.
But yeah, I think it helps because people are surrounded. I mean, if you have a spouse that wants to go out to eat every night and drink alcohol at dinner, it's gonna be challenging.
Yeah,
I
you have
mean,
to have a
I'm
hard
gonna
choice.
decrease your appetite, but down the road, I mean, if you go back to having 2 martinis a night, I
Hmm.
mean, you've gotta make choices. And I always tell people, you really don't understand how bad you feel until I do surgery and I get 50, 60, 70 pounds off. This has come on slowly, so you're living with it and you're
Yeah.
compensating. But boy, if I get that under control, especially if they stop smoking and clean up things, it's unbelievable the changes that happen, how good they feel.
Mhm.
It
Mhm.
really is amazing. Like that right there, I think is the most amazing part that I get to see people experience, right? Either whether they have the surgery or they work with me for 2 weeks and they start trying to eat more salads, right?
Right.
Eat more vegetables. They start to see that like, "Oh, I felt horrible. I didn't realize that I felt
Yep.
horrible." And then they start to feel good. And then you have a day where I didn't get enough sleep last night, and then I maybe had a drink or two, and I ate, I don't know, a, I didn't start my day off with enough protein and fiber, well, all that stuff, right? And they go, "Wow,
You can tell
I
the
feel
difference.
really bad," right? And they start to feel that difference that they never understood they felt before.
And I'm not so hardcore. I believe in everything in moderation. So if
Mhm.
you have a drink once in a while, that's okay. If you I tell patients, "Don't call me because you ate a piece of pizza the other night and you're crying. It's okay.
Yeah.
It's not the end of the world. It's big changes." So if once a week I always tell them, "If you go to a football game and you're eating nachos, no problem at all. If you've had a sleeve, it's gonna limit your amount of nachos, so you're not gonna go too berserk. But most of the rest of the time during the week, make good choices."
Yeah.
And I would argue that everybody knows good choices for the most part. You know that fish and chicken and meat are good for you, vegetables are good for you, concentrated carbohydrate, chips, crackers, cookies, pops, bad for you. It's not an education problem. It's not that the patients aren't smart. It's that they can't overcome that drive. If they've dieted for 6 days and they're really hungry and they go eat half a bag of chips on the weekend, they've just ruined that whole week.
Yeah. It's so easy to do. And I mean, like you mentioned, the people in your household play such a big role in that as well.
For sure.
It's hard to just make a change by yourself and let everyone else around you continue to do the same thing.
Mm-hmm.
Yeah, it's challenging. I mean, weight loss is it's not easy. It's not, and we see that every day. And I love hearing you talk because you just have so much passion behind it.
Yeah,
Yeah,
it's pretty unbelievable. I mean, and how people just really internalize and think that they're terrible and how bad this is, because you don't feel the same way about blood pressure. And your body's been designed for 2,000 years to eat a certain type of diet, and we've completely changed everything. And it's not bad. I mean, if your kids are playing sports and you're running and you're taking 6 kids around all kinds of things at night, everyone's busy, you've gotta eat some fast food, but the calories that we're taking in have changed completely.
yeah,
What I tell people, I'm making your stomach the size you need for the food supply today. The food supply to you're not hunting a deer tonight for dinner, and if you don't kill something, you're not gonna eat.
Hmm.
Nope, there's a quick star, there's something around, you're gonna get food, and very high calorie food. So, we really need to regulate that appetite. Now, it is exciting that the medicines are coming along, and so it's kind of a another option. I would say the surgery is the most powerful, and you're gonna lose the most weight with very low risk, less risk than having your gallbladder out. Like I say, I've done thousands of the surgeries. The other option is there's injectable medications right now that are a synthetic version of the same hormone that you make when food goes into your small bowel. And we're just giving it to you saying, "Hey, slow down, we're full." It'll decrease your appetite. And hopefully by March or April, there's going to be an oral version of this. The medications don't work quite as good as the surgery, but they're awfully good. And some people, they make nauseated. Some people can't tolerate them. So
Mm.
perhaps those are the ones that are still going to have surgery. But currently, we have over 40 million people in the United States obese. So there's a lot of people that really need help because we can really change heart disease, cancer rates in the country. The biggest thing I always tell people too, especially I saw one just yesterday, 2-year-old daughter running around the room. I'm like, "Do you plan on being there for her wedding?" It's a big deal.
And I think that's where, a lot of people come in motivated for those reasons. But again, to our point, like executing it and staying with it is the challenge, right?
Yep,
Because you can be motivated for sure during that short time, but once you start doing it and
for sure.
trying to live it out, it makes it more
But you
challenging.
have to look at the research too. I mean, if you look at any medical weight loss program that somebody's on for a year, they almost always gain the weight back
Yeah.
unless we do something. I like The Biggest Loser. These people tried so hard on a ranch in a weird environment, exercising constantly, lost a tremendous amount of weight. They are very invested on keeping that weight off. They're down 200 pounds. They feel great. Almost all of them have gained their weight back. Like 99%
Is
gained
that
their weight
right?
back.
Yeah.
Mhm.
Jeez.
Yeah, some of the seasons were studied in different things by some research groups, but they almost always gain their weight back because their body is trying to reset them back to that point. So whenever you look at people, there isn't a more invested, "Hey, I've known the benefits, I feel great now, I wanna keep this weight off." Okay, so how many kept the weight off? And if it's 1% or 2% at a certain point, it's futile because 'cause you're not gonna take 40 million people and put them on a ranch
Mm.
exercising for 6 months.
Yeah.
Ain't gonna think.
And then expect them to keep it off after that,
Correct,
right? Yeah.
correct.
Let's talk about medications a little bit. One thing that I have a question about, and I'm curious on your thoughts on this, is how many individuals post surgery go on medications, and what are your thoughts on that?
It's weird to ask medication questions to a surgeon. Am I gonna put myself out of business?
Well, I mean, I
So
don't think you will put yourself out of business just because I think I'm trying to maybe guide you to they can maybe work really
yeah,
well
no, no, I have
together.
a strong opinion about this. So, I think in our practice, we do the surgery to see how you do. And if you lose enough weight, we don't have to do anything at all. We can add the medications if your appetite comes back or you're not losing enough weight. There was a recent study published showing that if we put patients on a GLP medication within 3 months of their surgery and look at their 1-year weight loss, it was 10% better than people who didn't take the medicine.
Within three
So if I do a
months.
sleeve on somebody today
Hmm.
and I don't put them on anything, they might lose 60% of their excess weight a year from now.
Okay.
But if in 3 months I put them on a GLP, they'd be at 70% excess weight loss.
So you're saying like
The
6 to
medicines
12
will
weeks.
augment the surgery and get even better weight loss.
Uh,
I think we don't necessarily have to put everyone on it. We always just start see how you're feeling. And if at 3 months you're losing weight, feeling good, but it is an option, which when the cost is prohibitive and outrageous, then we can't do that. But as the costs come down, I tell people I think it's gonna be like breast cancer. If I do a mastectomy, I'm gonna put everyone on tamoxifen to try to prevent regrowth of that tumor.
mhm.
I don't want your disease to relapse or come back, and if your disease is obesity, I'm gonna put you on a medication probably someday to keep it in
Mm,
remission. So I personally think if the cost was no issue at all and these medications become oral and easily to give somebody, we'll probably have most people on them too.
yeah.
Wow.
So strong. So okay, you mentioned the study you talked about. How do you currently practice that? Because it looks like we're waiting at least a year before maybe we think about putting them on medication,
We're
or
in
is
discussions.
it?
We're
Yeah.
in discussions right now.
Okay.
I mean,
In
it's
discussions.
one thing if you go to get Zepbound and it's $1,200 a month
Yeah.
and people can't afford that. But all of a sudden, the most recent report I heard from the government is that the orals may be out by March. And if you have an oral medication available for $150 a month, and if your Medicare will cover or have copay, so maybe your copay is $50, $75, something like that. So then it becomes a different discussion rather than saying you're going to be spending $1,200 a month. Well, okay, but if it's $50 a month and you could lose another 30, 40, 50 pounds on top, maybe.
Yeah.
Maybe. So I think we haven't been because things have been changing rapidly. But if I look 2 and 3 years from now, we're probably gonna use especially for the higher BMI patients. If your BMI is over 50, if you're 200 pounds overweight or more, I would say you have a very severe form of the disease, and we probably need to do surgery and a medication.
Hmm.
We don't have to. Maybe you lose enough with exercising and doing surgery, but we can.
Yeah. Yeah. Have you looked much into like microdosing? I mean, it's kind of a fancy word for just saying taking less of the medication, right? But everyone loves fancy words. So have you, I mean, I'm sure you've heard of it already.
For sure.
What are your
I
thoughts
know
on
a lot
that?
of people doing it and things.
Yeah.
I always tell people, just like compounding, just like exercising, we're all on the same team and we're really trying to help people.
Hmm.
And people were so against the meds, think it was a vanity thing, like a movie actor wants to take it so they have six-pack abs and they can be in the superhero movie, all that sort of thing. But you also have to remember, even if you lose a little bit of weight, let's say you're 50 pounds overweight, you lose 25 pounds, you have improved your heart disease profile, your cancer profiles, your cholesterol, everything's a lot better.
Hmm.
So I'm a lot less negative than I would have been in the past. I mean, you want to follow FDA guidelines and things, and we practice evidence-based medicines and
Yeah.
we only use it for the indication. But I think the reality is anything that we're doing, and so what you're alluding to is could we take some people who aren't as heavy and use an even lower dose of medicine and catch them before they get morbidly obese? Probably.
Yeah.
And I don't think it's a bad thing. I
Yeah.
don't think it's wrong per se in the long run.
Yeah. Yeah. Um, And I think that was a good plug there. Like we obviously are not prescribing it that way because that's not how it's not what it's
Right,
indicated for,
right.
but it's definitely being done outside of these walls. And yeah, I was just curious how that would potentially, um, well, what that will look like from a
Mhm.
clinic standpoint, but
Uh-huh.
also, are we in talks about it? Because
For sure.
how would we even go about that?
Yeah,
I don't know.
I think we'll get there. And I think the other thing, it highlights the importance of having an organized team of professionals that do this all the time.
Hmm.
Because very often I hear of people that went to their family doc, they put them on the maximum dose of GLP, they were nauseated, they were throwing up, they threw their pills away, they felt terrible, they never took it again. And maybe this patient just needs a low dose. Maybe they need a microdose. Maybe they need a lower dose. Maybe they take it every other day. There's ways to adjust. I think I'm a minimalist as far as medicine. There's an old Seinfeld joke, figure out what dose that kills me, back it off just a little bit. That's what I want. I think you should take the lowest dose that's effective because you're gonna have less side effects. So if we have a few doses, let's start easy and work our way up because maybe you won't have the side effects issues and problems. And so that's where I think it's important to work with medical practitioners who do it all the time rather than going somewhere and they have 40 patients today they're gonna briefly talk to you, "Here, take this script, you're gonna be fine."
Yeah. Yeah. Yeah, that's I mean, another reason why you should come to the Iowa Weight Loss Clinic, right? Iowa Weight Loss Specialist.
I'm
Yeah.
a specialist.
Just a
There
little
you go.
plug.
But
We're great.
yeah, and I think that's honestly too like the research talks about it's not like the medication, awesome. Surgery, it all comes together. And that's
Mhm.
why we have all that's why you wanted this,
For
right?
sure,
Because the research shows that
for sure.
together is what makes lasting change.
Yeah,
Yeah.
absolutely. It's pretty funny because I feel like we're all on the same team, but you'll see celebrities come on and say, "Oh, the medicines are terrible," or they'll say, "This exercise program, you do Body for Life, it's the greatest thing."
Mm.
We're all on the same team,
Mhm.
and we just need different tools, but you need to see some experts. You're not gonna go to the bookstore and grab a book and change your life by doing one diet program or something like that. You should come and talk to the experts and really work with a team.
Very few people can do it that way.
Very few,
Right? Yeah.
very few. It's
Yeah.
unusual.
Yeah. Yep. Most people that are, on social media can do it that way, I guess. Um, I guess with that, I mean, this has been great so far. I don't think I have much else there,
I don't think I have
given.
any other questions for you right now either. Is there
Yeah.
anything else that we haven't covered that you're interested in talking a little more about?
Mm, I think the main thing everyone has to understand, just don't be afraid to come in. The first step, most people have thought about it for years and they're really afraid.
Mm,
I get patients almost in tears when I walk in. My joke is, I'm not going to do surgery on you today. You can relax, take a deep breath.
sure.
You're okay. But to really get the information, and we have free educational classes online and things, so you deserve to get the real deal. And again, here I am, a surgeon promoting medications and different things. At this point in my career, I don't care about money. I don't care about anything. It's about how many people can I help and what can we leave as a legacy and what have we built here. And I think the access to the sleeve and the access to the medications just recently being adopted by the government and everyone starting to cover these things. I think we're at a point where we're gonna see the entire country change because people are so much against it. But like when Dr. Oz was standing at the White House talking last week, if you look at heart disease, you look at diabetes, you look at these things, they're killing our country. And if you come in and work with us, it's not a vanity thing, it's a health thing. And if I can cut your heart disease in half, then you can be there for your daughter's wedding. You can dance, you can go out, you can play with your kids, you can do the things you want to do. So it's exciting.
Yeah.
I
Very
love it.
exciting. That
Only
was
get
great.
only one of these things called life, right? Like you
That's
just
Yeah.
get to
right.
it once. So
Yeah.
That's right, for sure.
yeah.
And I think, you should look back on this, but you said at this point in your career, you don't care about the money or anything. You're here to help others, right? I'm assuming that's probably one of the main reasons you got into this as well.
Yeah,
So it's kind of
absolutely.
full circle,
I
hopefully.
can pull up every now and then my wife sends me a before and after picture if I'm having a bad day. She sent me one the other day. A patient of ours is 3.5 years out. She's down 170 pounds. And so when I look at stuff like that, I mean, I feel good about it. It's amazing. It's changed her life. It's completely different. And we have hundreds and hundreds of those stories every day. So
Yeah.
so
Pretty
I
cool.
love the office. I come in and everyone's happy, tells me how great I am because they lost weight. We're high five and it's fantastic. So
Not a bad day in the
I
Fills your
office.
bucket.
My other joke is I always tell the dietitians it's the greatest place to work because if I give the patient a tool that I control their appetite, all of a sudden, all of this stuff that you're telling them makes sense and it works and they can do it. I talk about breaking the cycle of failure that they're in and getting in a cycle of hope. That all of a sudden now they're on a medicine or surgery, they lose some weight, they start feeling good. Now they set new goals. Now they start exercising. Now they start doing things.
Yeah.
But as a dietitian out there doing diabetic education with someone, you can sit there and tell them, okay, eat 1,200 calories today. Okay. But over the years, that's hard. It's really hard. So you're set up struggling all the time.
Yeah. We could probably talk for hours more about that, but it's a pretty great place to work. I would agree with you.
Yeah.
Mhm.
Yeah. So
Absolutely. Well, thanks
Cool.
so
All
much
right.
for sitting in here. This was
No
awesome.
problem.
Really appreciate you coming on. This was another episode of the
the
Well-ish
Wellish
podcast.
podcast. Yeah.
Thanks, guys.
Be you.
All right.